Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. While the Omicron variant continues to spread, causing increased hospitalizations in our region and across Ontario, we're beginning this week with some hopeful indications that our efforts at vaccination and public health measures are succeeding. One of the measures we're now using to assess the intensity of COVID-19 in our region is COVID-19 signals in wastewater. The most recent wastewater signal suggests that we may be reaching a plateau of cases. This finding agrees with our forward-looking models that show our COVID-19 cases peaking this week or next. So while we continue to face challenging times, we can be reassured that our hard work and sacrifices are bearing fruit. Another good news story is schools. This week, children in Ontario returned to in-person learning, snowstorm notwithstanding. As we've seen over the past weeks, there's a broad consensus among public health practitioners, healthcare, community members, and politicians that a return to in-person learning is in the best interest of the mental, social, and physical well-being of our children. School is the best place for children right now. That said, the return to school may be worrisome for some parents. New provincial guidelines means that cases will no longer be reported in schools and cohorts will not be dismissed, so parents are understandably concerned. However, new provincial screening guidance, as well as distribution of further rapid tests for symptomatic children, will help keep COVID-19 outside of schools to the extent possible. The most important thing families can do to protect their children and themselves is to get vaccinated. While the risk of severe illness due to COVID-19 is low in children, the risk is much, much lower in vaccinated children. In York Region, well over half of children aged 5 to 11 are vaccinated with at least one dose, and over 90% of 12 to 17 children. And I'm hopeful that we'll be at 10% with second doses in that younger age group by the end of this week. If your child has not had a first dose, please walk in or book an appointment at any York Region clinic as soon as possible. For many York Region children who had their first dose in late November or early December, the 8-week interval is quickly approaching. Parents may also choose a reduced interval to have your children fully vaccinated sooner. You can get your child's second dose as early as 21 days after the first by providing informed consent at one of our clinics. As a reminder, children and anyone who is still in need of their first or second dose can walk into any of our York Region clinics to receive a vaccine. You can also book an appointment if that's easier for you. If you're an adult who is yet to receive your first, second, or booster dose, now is the time. With the changes in testing eligibility and a restriction to high-risk setting or healthcare workers and others, our reported cases are only a fraction of actual cases. Unfortunately, the number of hospitalized patients in Ontario has reached almost 4,000 over this weekend, closing in on almost double the peak of the third devastating wave. 2 vaccine doses still provides 80% protection against hospitalization and 90% against ICU admission using our Ontario and global data. If you have access to a rapid test, you may test and may choose to report this to York Region Public Health through our online anonymous survey tool. You can access this online tool at york.ca/COVID-19 positive. One common area of confusion and controversy is when to get your vaccine if you've recently had COVID-19. You can safely get vaccinated as soon as you're feeling better and your isolation is complete. However, there is some evidence that waiting 30 days following your symptoms to get your next vaccine dose may provide more long-lasting protection. However, given that many people with symptoms haven't had access to testing and will not know definitively that their symptoms are truly COVID, it may be prudent to seek vaccination sooner rather than later. Regarding your booster, Ontario and global data confirm that mixed schedules of Pfizer and Moderna are safe and effective. Moderna is the preferred booster dose at this time, unless you're 18 to 29 years old when you should receive Pfizer, so don't delay. Approximately 5,000 new vaccine clinic spots are added every single day, and clinics in York Region, including those operated by our partners, are vaccinating 12,000 or more people every day. Anyone who is eligible for their booster dose can book an appointment at york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. Again, thank you to our residents who've been adhering to the modified Step 2 regulations. These restrictions have had an impact on our hospitalizations and ICU admissions and are very important to our healthcare system and to meeting the challenge of this surge of Omicron. I look forward to sharing more positive news with you in the future. Please stay safe, remain home if you feel ill, and get vaccinated.